So, Presiding Officer, no commitment to guarantee care packages for the 1,500 people needlessly stuck in hospital to free up much-needed beds and resources. No commitment to clearing long waits of over 2 years by Christmas, meaning patients suffering and adding pressures to A&Es, solutions that would unlock much-needed capacity in our NHS. Now, the Health Secretary published his winter preparedness plan 2 weeks ago, but has already been dismissed by key figures in our NHS. And rather than an actual plan for winter, they are supposedly moving to year-round surge planning, which, despite what the Health Secretary says, proves that we have a crisis in our NHS all year round, a permanent crisis in our NHS. So will the First Minister listen to the doctors and the nurses on the front line and come back to Parliament with an actual plan to meet the scale of the NHS crisis this winter?
First Minister.
The Government is putting in place the planning to do exactly that. That is the core duty of Government. We're also putting in place the resources at £19.5 billion, a record investment in the National Health Service, which of course is delivering for us increases in staffing levels to ensure that the capacity is there to deliver the treatment that is required within the National Health Service. And we have to recognise that the Government can only allocate the resources that it has at its disposal. And we are allocating a record amount of funding. Now, as Mr Sarwar knows, because we've rehearsed these points many times before, in the climate of austerity that we have wrestled with for the last 14 years from the Conservative Government, places significant challenges on the resources that we have put in place. But we have exceeded the amount of money that was allocated through the Barnett formula to the Health Service. We've exceeded that because of the commitment of this Government. So if Mr Sarwar thinks it will help by following his approach on taxation, which would reduce public expenditure in Scotland by £1.5 billion, that will not help the National Health Service one little bit if we were to follow Mr Sarwar. And as the United Kingdom Secretary of State for Health said when he was in opposition, that all roads do lead back to Westminster on funding. We wait to find out what the budget will tell us when Parliament comes back after the October recess. Let's see if the Labour Party breaks with austerity. Let's see if Labour are prepared to invest, because what Mr Sarwar has put to me today is a demand for more investment, and we're not getting that from the Labour Government.